46 women with diffuse alopecia received 200 mg per day of oral vitamin B5 plus daily intramuscular injections of vitamin B6 for 20 to 30 days. The treatment was repeated after 6 months, and it resulted in improved hair condition and reduced hair loss. Results from animal studies demonstrated vitamin B6 in combination with the amino acid L-cysteine prevented hair loss caused by chemotherapy. Severe biotin B7 deficiency can occur as a result of certain genetic mutations, and it causes hair loss as well as several other serious health problems. In one study, 38% of women with self-reported hair loss exhibited a biotin deficiency. In dogs, biotin supplementation can help to improve the hair growth, but human clinical trials have yet to verify this finding. Some preliminary evidence suggests that biotin supplementation might help to treat alopecia caused by the medication valproic acid. A growing body of evidence shows that vitamin D participates in the regulation of the hair cycle. In a case series of 210 women with female pattern hair loss, over 60% had below the normal vitamin D level. Low serum vitamin D levels are associated with autoimmune disorders, including alopecia areata. In a 12-week trial, 48 patients with mild to moderate alopecia areata were treated twice a day with a topical solution containing calcitrol, a synthetic form of vitamin D. At the end of the trial, more than 62% of the participants had 75% or better hair regrowth, and 27% of the participants had 100% hair regrowth. The case of a 7-year-old boy with alopecia areata is also compelling. After failing to respond to topical midazolam plus hydrocortisone, the boy experienced complete hair regrowth after 3 months of treatment with topical vitamin D. A study on 20 children with alopecia areata and 34 healthy controls found that vitamin D levels were inversely related to the alopecia severity scores. As vitamin D levels went up, the alopecia severity scores went down. Animal and preclinical models indicate topical vitamin D, as well as calcitrol, can help to prevent chemotherapy-induced alopecia, with some evidence suggesting the treatment can enhance hair regrowth. In one study, topical vitamin D significantly reduced chemotherapy-induced hair loss in female mice. Saw palmetto is popularly used to treat prostate enlargement and androgenic alopecia. A randomized control trial in 26 men, aged 23 to 64, with mild to moderate androgenic alopecia, found a combination of 200 mg saw palmetto extract, 50 mg beta-cysterol, along with complementary amounts of lecithin, choline, inositol, niacin, and biotin, was effective for measures of hair growth and quality. Self-assessment of satisfaction with hair growth and appearance and investigative staff assessment of hair density both markedly improved. An uncontrolled study in 50 men, aged 20 to 50, with androgenic alopecia, found a topical saw palmetto extract increased the hair count. Another trial compared the effects of 320 mg of oral saw palmetto extract daily to 1 mg of finasteride daily in 100 men with mild to moderate androgenic alopecia over 2 years. Finasteride led to hair regrowth in 68% of the subjects, while 38% of those in the saw palmetto group experienced improved hair growth. Treatment with saw palmetto was well tolerated. The researchers believe saw palmetto's ability to inhibit 5-alpha reductase is at least partly responsible for its positive effects, and some have proposed that combining saw palmetto or beta-cysterol with anti-inflammatory agents like carnitine and alpha-lipoic acid may enhance its effectiveness. In a trial in 120 women with early-stage hair loss, it found 6 months of daily supplementation with 460 mg of fish oil, 460 mg of blackcurrant seed oil, providing gamma-linoleic acid, 1 mg of lycopene, and small amounts of vitamin E and vitamin C led to improved hair density compared with a control group. The supplemented group also had more anagen phase hair and less telogen phase hair compared with the placebo. In a rodent study, most animals taking DHA, an omega-3 fatty acid found mainly in fish oil, were protected from chemotherapy-induced alopecia. In another study of 6 rhesus monkeys with hair loss, daily treatment with omega-3 and omega-6 fatty acids was associated with decreased alopecia. Several studies have found that attaching DHA to Taxol, a commonly used chemotherapy drug, reduced the drug's toxic side effect, including alopecia. Protein deficiency is a well-established cause of hair loss, and one protein, keratin, is the main component and the primary structural element of hair. Age-related decline in keratin synthesis may lead to a deterioration of the stability and the flexibility of the hair shaft. This could then leave the hair vulnerable to dryness and breakage, with bruising and use of styling products and tools. In one study, a supplement containing a novel form of solubilized keratin, cytidine, plus vitamins and minerals was compared with placebo in 50 women who had signs of stressed or damaged hair. Cytidine contains a specially processed, highly bioavailable peptide form of keratin, a rich source of cysteine. After 90 days, the cytidine formula group had less hair loss, improved hair strength, improved anagen phase, telogen phase, and anagen to telogen ratio, and better hair appearance when compared to placebo. Silicone is a trace element and is present in the body in small quantities. It's thought to function as a structural component of hair. Silicone compounds are common in many edible plants. 2 studies have looked at the effects of supplementing with orthosilic acid, which provides silicone, on the hair health. In one study, 50 women were given 10 milligrams of orthosilic acid or placebo daily for 20 weeks. By the end of the study, hair brittleness decreased in the women who were receiving the silicone supplement. In the second study, 48 women with fine hair received the same compound or placebo for 9 months. Hair strength and elasticity were better preserved, and hair thickness increased in the supplemented group compared with the placebo. Zinc deficiency has been associated with hair loss. Zinc plays an important role in normal hair follicle activity, preventing follicle regression and enhancing follicle recovery. Also, zinc can act as an anti-androgen and a modulator of 5-alpha reductase. Men and women with androgenic alopecia, telogen effluvium, and alopecia areata have all been found to have lower zinc levels than people with no hair loss. Early research suggests using supplements to correct a zinc deficiency in people with related telogen effluvium can improve the hair loss. Lower zinc levels in patients with alopecia areata have been correlated with increased severity and longer duration, and a higher likelihood of treatment resistance. In one uncontrolled clinical study, 15 subjects with alopecia areata and low zinc levels, lower than 70 micrograms per deciliter, received 50 milligrams of zinc gluconate per day. After 12 weeks, hair regrowth was seen in 9 subjects, and was correlated with improved zinc status. In addition, case reports suggest continued zinc gluconate supplementation may help to maintain hair recovery after the treatment of alopecia areata in those who respond to ultraviolet light therapy plus zinc. Tocotrienols, a member of the vitamin E family, are naturally found in barley, wheat germ, and certain types of grains and nuts. Similar to tocopherols, the more familiar form of vitamin E, there's 4 tocotrienols, labeled alpha, beta, gamma, and delta. Tocotrienols are recognized to have important vitamin E activity, particularly with regard to their anti-inflammatory, cholesterol-lowering, and radioprotective properties. Emerging evidence suggests tocotrienols can help to promote healthy hair. In a study involving 38 women and men with various types and degrees of hair loss, those who were receiving supplements with 23 international units of alpha-tocopherol plus 50 mg of mixed tocotrienols experienced a greater than 34% increase in hair numbers over 8 months, while those who were receiving a placebo experienced a slight decrease in their hair numbers. There's evidence that green tea and its main polyphenol, epigallocatechin gallate, or EGCG, can help to prevent hair loss and aid in hair regrowth. In a mouse study, a topical EGCG solution protected against testosterone-induced hair loss. In a study in mice with spontaneous hair loss, a green tea polyphenol solution added to drinking water promoted hair growth versus no growth with plain water. EGCG stimulated dermal papilla cells, and it promoted hair growth in human hair follicles in a lab setting as well as in human subjects. Selenium intake is important for healthy hair follicle function, and selenium deficiency can play a role in hair loss. In an 8-week randomized control trial in 64 women with polycystic ovary syndrome, 32 received 200 micrograms supplemental selenium, while the other half received a placebo. At the end of the trial, the selenium group had a significant reduction in hair loss compared with the placebo. Melatonin can be helpful as a topical treatment for hair loss. While not yet known how melatonin can combat alopecia, its ability to counteract oxidative stress is thought to play an important role in hair loss, and its ability to stimulate hair follicle growth has been suggested. In an early control trial, 40 women with female pattern hair loss or diffuse alopecia applied 1 milliliter of either a 0.1% topical melatonin solution or placebo solution to their head nightly. After 6 months, the topical melatonin group had significantly more hair in the anagen phase. A set of 4 studies in men and women with early-stage androgenic alopecia evaluated melatonin combined with other topical agents as a treatment for hair loss. In the first study, a 0.003% melatonin solution, also containing biotin and ginkgo biloba extract, was applied nightly to the scalp of 30 men and women for 3 months. Both investigators and the participants reported a decrease in the severity of alopecia on day 30 and an even greater improvement on day 90. In the second study, 35 men used the same solution nightly for 6 months. Investigators noted an average of 29% increase in hair number and density after 3 months, and an almost 43% increase in the number and 41% increase in the density after 6 months, with more than 50% of the participants responding to the treatment. The third study used a hair count test in which the participants counted the number of hairs lost during 60 seconds of combing each morning as a measure of response. Lost hair counts decreased over the 90-day trial in 20 female participants, but not in the 40 male participants using the melatonin solution. The final study included 901 men and 990 women who applied the solution nightly. The hair pull test showed no hair loss in nearly 62% and new hair growth in nearly 23% of the participants after 3 months of treatment. In addition, treatment with melatonin solution appeared to improve the seborrhea, the red, itchy, scaly skin in the participants with this condition of the scalp. Iron deficiency can cause telogen effluvium. Low levels of ferritin, an iron-storing protein, have been observed in women with female pattern hair loss, telogen effluvium, and pre-menopausal hair loss. One study found the lowest ferritin levels were associated with the most severe hair loss. Assessments of iron status and iron supplementation, if necessary, can be considered in women with hair loss. For more on herbs, supplements, or natural treatment plans, check out my website.